Hi, everyone. I'm Alana. I'm a massage therapist in Cochrane, Alberta. Thanks for being here for this presentation on vagus nerve health. Some of you might be watching this live, in which case there'll be time for questions at the end. Others of you might be watching a recording of this, in which case I'm very happy to answer questions. I'll have contact information at the end of the presentation, so please feel free to shoot me an email or find me on social media if that's your thing, and I'd be happy to chat about vagus nerve health as much as you like. We will be discussing the nervous system really briefly. I'll give a brief overview to the nervous system. We'll be talking specifically about the vagus nerve, what it is, where it goes in the body, what kind of conditions it affects, and what kind of symptoms we might experience if we are not very healthy in our vagus nerve. And then we'll talk specifically about ways to stimulate the vagus nerve in order to increase its health, which I hope will help reduce whatever symptoms it is you're experiencing that prompted you to come and join this presentation. I do want to preface this discussion by saying I believe that a lot of the conditions we're going to talk about are complicated. They are difficult to diagnose. They're difficult to manage. They're often overlapping. And though this is simple and helpful, it is not a cure-all. It's not going to typically cure any condition that you're experiencing, but it should reduce the symptoms, help you manage your symptoms. And I have seen that benefit myself. I've seen it for a lot of my clients. So I don't want to disrespect any of the conversations or any of the conditions that you might be experiencing and the complexity of those. I know for a lot of you who experience chronic pain, you might be used to a therapist or a doctor or somebody telling you, just do this thing, just do that thing. I have a great solution for you. And that can be exhausting and frustrating when it doesn't work. So let's get into our presentation on vagus nerve health. I have chosen this background for my presentation because this is an area of the world that I find very regulating to my nervous system. I'm very peaceful when I'm here. This is Kootenay Lake in BC. And so I thought it'd be appropriate for this conversation here. Okay, so talking about the nervous system, we're talking about a massive structure that goes throughout the whole body. It's not just the brain, but also the spinal cord, the enteric nervous system. That's the nervous system that exists in our gut, which is massive, and we actually know very little about it at this point. We're also thinking about all the ingoing and outgoing nerves that interact with each of these structures. And then all of the components of the nervous system, like neurotransmitters and nervous system receptors and sensory information that's coming in from receptors in the skin or in the muscles, all of any structure that is involved in communicating along these channels. Our nervous system is incredibly connected to our immune system and our endocrine system. I won't be going into that in detail because I know very little about it, but there's a really interesting branch of science that is studying the nervous, the immune system, the endocrine system, and how they interact with each other. And I think it's important to have the perspective that the nervous system really is throughout the entire body. It deals with all the structures. It deals with all of our processes. It's what manages our homeostasis and keeps us healthy. And it is really connected throughout the entire body. So when we talk about a mind-body connection, we are really referencing how that nervous system interplays with every other structure in the body. It's divided into the autonomic nervous system and the somatic nervous system. So your somatic nervous system is what allows you to do movements, make major muscle movements, and it is within your control. Our autonomic nervous system is below our conscious control, and that's where we're spending our time today, is with the autonomic nervous system. We will discuss nervous system regulation. This is a term I hear talked about a lot, and sometimes in those discussions, it seems as if there's a message that to be regulated in our nervous system means that we're always calm, that we're never stressed. And that's absolutely not true. We do need to have a stress response. It's healthy, it's normal, but we need to be able to switch between our stress response and our relaxation response. And that's what I'm talking about when I say nervous system regulation. Our nervous system is adaptable, it's flexible, it's teachable. It likes to do the same thing over and over again. So when we give consistency to the work of nervous system regulation, the nervous system learns that we want to be able to do those skills. And neuroplasticity is really, it's a term that talks about learning. It's the brain's ability to adapt its structures or functions in response to stimulus. We do not lose our neuroplasticity completely as we age. We are definitely more neuroplastic when we're infants and children, but we retain the ability to learn and to change our nervous system, to have it adapt right up until the point of death. So we are all neuroplastic, and that's a big part of the work that we're doing here. Our autonomic nervous system. So this is our nervous system that functions completely below our conscious control. We don't need to think about the, say, regulation of our blood pressure, for example. This system, the ANS, should be able to switch back and forth readily from our sympathetic to our parasympathetic response. So from our stress response to our relaxation or our resting response. So let's talk about each of these in turn. The sympathetic nervous system, or a stress response, allows us to respond to stress, to perform, to exercise, to work hard to meet goals. It raises our heart rate, our breathing rate, and it sends blood to our muscles instead of our brain and our digestive system. It is fast, it's automatic, and you probably all recognize what this feels like in a very stressful situation when you have that adrenaline dump and you feel your heart start to race, your breathing, maybe even start to hyperventilate. You might get sweaty or hot or prickly feeling. That's a very fast response of your stress system, your sympathetic nervous system. But also if you are playing a sport, with some competition, especially, you're still in this stress response, but it feels different. It doesn't feel bad or scary. It feels productive and healthy and fun. So our stress response, though it's managed by one system, it is varied and it responds to the different inputs into our life in different ways. Our parasympathetic nervous system, or our resting or our relaxed response, allows us to be relaxed, to digest food, to recover, to repair injury. It allows us to use our executive functions, so strategic thinking, time management, attention, focus, emotional regulation. It allows us to connect socially, especially with people that we love and feel safe to us. It slows our heart rate, slows our breathing. It sends blood to our brain and to our digestive system. It is also fast and automatic, but it's not as fast as the sympathetic system is. So when we talk about nervous system dysregulation, this really just refers to a lack of ability to switch back and forth from our stress response to our relaxation response appropriately. We might get stuck in our stress response. We have vague and overlapping stressors now. This system is evolved to deal with pretty discrete, meaning a beginning and an ending stressor. Something like being chased by a predator, for example, would be a stressor that we could identify when it was happening and when it was over. And then at the end of that stressor, we could switch back into our resting response. We don't tend to have stressors like that, most of us anymore. Our stressors are a little bit more vague, they're overlapping. Maybe they're with us all the time because our stressors might be coming from our work environment or our family environment, and it's hard to maybe leave those places or those situations behind. Maybe we have nervous system conditions like depression, ADHD, trauma, and anxiety, just even really high stress, really high cortisol levels. The nervous system might become stuck in our stress zone. We don't tend to get stuck in our relaxation zone. And we just lose some of that ability to naturally switch back and forth to our resting state. However, as I mentioned earlier, our nervous system is very trainable, very teachable, and we can inform ourselves of when we are actually safe and it's time to get back into our relaxation state. Another thing to keep in mind here is that incoming information from our outside world is always going to be prioritized over information from inside of our bodies. Our threats come from outside, so our nervous system will always prioritize confusing or threatening information from our environment over maybe the state of our chronic inflammation. That doesn't feel like a threat to our nervous system. So that's a part of our dysregulation. We can become dysregulated for a lot of different reasons. And I think for the purposes of this presentation, we won't cover all of the ways that we can become dysregulated, but I'm hoping that as we discuss this, you'll start to recognize how you might be dysregulated in your nervous system. So states of our stress response. The nervous system's main job is to keep us safe. When we're faced with a stressor, we might tend more towards a fight or flight response, or we might tend more towards a freeze or shutdown response. Some people tend to be more one way or the other, but for all of us, different situations might get us up into our fight or flight zone or might present as a freeze or a shutdown. Both of these responses are designed to keep us safe by reducing threats, whether we're elevated or we go into that sort of more depressed nervous system state. So if we can run away from a predator, we're going to do that. If we can't run away from a predator, we're going to fight that predator. If we can't fight off a predator, if we freeze in place, we become less threatening. So you can imagine this is like the squirrel that runs across your lawn and freezes right in the middle of the lawn as if you can't see it anymore. And if freezing in place doesn't help, maybe completely shutting down, curling up in a little ball like a possum and pretending you're dead. These are all ways that obviously other animals use, but that humans use in order to reduce threats from our environment. And these can present differently. I tend to be more of a fight or flight person. And so I tend to be a little bit more hypervigilant, a little bit more easily irritated. And my response is usually just getting really angry at whatever feels like a threat in my environment. Other people might present as a severe lack of motivation. I feel like I can't get out of bed. I can't go to work. I can't face my day. Or maybe chronic pain keeps you at home, keeps you in bed or on the couch. That is also a way for your nervous system to keep you safe. If your nervous system can reduce your motivation to the point that you're not going to go outside and face those threats, then your nervous system feels like it's doing a good job of keeping you safe. When we have actual danger cues that are legitimate, we need to be able to pay attention to those. I don't want to imply that we should be able to never respond with a stress response to the cues that are coming in from our environment, because sometimes there are really important cues that we're not safe in the situation that we're in. But when we know logically that we are safe, there are ways that we can use our body to inform our nervous system so that we stop responding as if we're in danger when we're not actually in danger. Okay, this brings us to our vagus nerve. So the vagus nerve is a cranial nerve. It leaves the brainstem and it travels through the throat, the thorax, or the chest, and the abdomen. It has three main roles: your mind-body connection, which we call interoception, our perception of our interior selves, the gut-brain axis, and the parasympathetic or relaxation response. So we'll talk about each of those in turn here. So mind-body connection or interoception. 80 to 90% of the information or the activity of the vagus nerve is incoming information from the body to the brain. This is the basis of our interoception, our ability to perceive the state of our internal bodies. It deals with a lot of different structures in the body, and you'll see as we kind of list some of these structures, how the symptoms that maybe you have been experiencing might match up with this list of structures that the vagus nerve deals with. So it's going to bring in information from a bunch of these structures. It also does a little bit of outgoing information. So 10 to 20% of its work is outgoing. So it's activation of different structures in the body. Deals with swallowing, vocal cords, the esophagus, and the trachea. So the passage of air and food in and out of the body. Deals with the heart and the lungs, the center of the diaphragm, the stomach, the full gut. So all of the intestine. Deals with all the critical organs, the endocrine system. So all the hormone structures that are in our abdomen, our lymphatic system, and our circulatory vessels. So the size of our arteries is regulated by the vagus nerve activity. So as you can see, just based on this, we're dealing with quite a lot of information incoming into the body or into the brain. It's also the gut-brain axis. We talk a lot about gut-brain axis. All of the information that travels between the nervous system centered in your brain and the nervous system centered in your intestines is traveling via the vagus nerve. The enteric nervous system is composed of vagus nerve cells embryonically, so it's got a very strong connection. So this means it deals with gut motility, how fast food moves through your digestive system, stomach acid composition, how much you have, how acidy it is. It deals with your digestion. It deals with emotions like anger, anxiety, sadness, elation, passion. These are all what we would call gut-based emotions. It deals with your gut microbiota and immunity and inflammation. A lot of that happens within the enteric nervous system, so the vagus nerve is intimately connected to those. It is what starts and regulates our inflammatory response, whether that's inflammation in response to a sudden injury or it's chronic inflammation. That is one of the roles that the vagus nerve does, and is really important in managing a lot of the conditions that we deal with. It is also what initiates our parasympathetic, our relaxation nervous system. So after a stressor, during sleep, when we're at rest, the vagus nerve should be turning on the rest and recovery mode. This allows for safety, which a friend of mine who's into vagus nerve work calls calm aliveness. I love that description of what it feels like in our body to have a safe feeling nervous system. It allows for connection with others. It allows us to do our executive function, repair, recovery of injury, and digestion, amongst other things. But these are our highlights of our relaxed nervous system. There's a few other nerves that connect very strongly anatomically and functionally to the vagus nerve. And so when we have difficulty or inflammation in any of these other nerves, we will have difficulty with our vagus nerve and vice versa. They make this little club that, you know, when one of them is angry, the rest of them all get angry in response to whatever threat is happening in that one nerve. So these other structures are pretty important to manage as well. The trigeminal nerve, this does all of our muscles of chewing, so all of our jaw muscles. So anybody with jaw dysfunction, the trigeminal nerve is going to be inflamed. It will probably mess up the vagus nerve. It also deals with our sinuses. So people who have a lot of sinus pressure or facial swelling, usually there's a problem with the trigeminal nerve. It deals with the spinal accessory nerve, which actually activates trapezius and SCM, sternocleidomastoid. These are both muscles in the upper shoulder and neck that are prime movers of the head and neck. So when we have chronic neck and shoulder tension, often there's a problem with that spinal accessory nerve. Also headaches, both TRAPS and SCM are big headache causers, as are the muscles of the jaw. So both of those nerves are really important for managing chronic pain to the neck and shoulders and the head. It also deals with our facial nerve, which manages all of our muscles of facial expression. And it deals with our hypoglossal nerve, which does tongue movement. So tongue, swallowing, moving food around in the mouth. The information coming in via the vagus nerve is processed in the same area of the brain as information coming from our external environment. So this is one of the reasons we end up less healthy in our vagus nerve than we should be, because again, our brain is always going to prioritize that external environment information that's coming in. So if there's confusion, overstimulation, or threat from the outside world, we can start ignoring the information that's coming in from the vagus nerve, and that leads to some vagus nerve dysfunction. Okay, so these terms, in my opinion, are interchangeable: vagus nerve dysfunction and ANS dysregulation, or autonomic nervous system dysregulation. Here are some of the symptoms that come along with these. So we've got our inflammatory gut conditions like IBS, ulcerative colitis, Crohn's, heart rate irregularities, headache and migraine, chronic neck and shoulder pain. Those two are very connected with each other. And let's throw jaw dysfunction in there as well. Sinus or throat congestion, having a really hoarse voice when you're stressed can be a sign of vagus nerve dysfunction. Chronic unexplained pain and chronic pain conditions. The vagus nerve helps us to classify pain and understand how severe it is and how it should be managed. We might have breathing difficulties, mood disorders like anxiety and depression, brain fog and memory problems, internal organ dysfunction, acid reflux, tinnitus, or ringing in the ears. And I should add vertigo to this as well. So all of those are symptoms of ANS dysregulation, our inability to shift happily between our stressed and our relaxed nervous system, and or vagus nerve dysfunction. So there is a ton of research going on in vagus nerve stimulation right now. It's pretty exciting. There are current studies and studies just completed. And that actually means that a lot of this information is pretty new. When we talk about vagus nerve stimulation, kind of still on the fringes of healthcare. It is starting to be a little bit more well-known, a little bit more popular, and there are a couple of specific conditions that are being managed or can be managed with vagus nerve stimulation. Treatment-resistant depression is one of those. Medication-resistant epilepsy is another. Some headaches, cluster headaches, and some migraines, and stroke recovery as well. So those conditions all have Health Canada or FDA approved devices that can be used to stimulate the vagus nerve. But there's also ongoing research and very current studies in a lot of these other conditions that are listed here. So cancer recovery, stroke recovery, and TBI, or traumatic brain injury and concussion recovery, fibromyalgia, chronic fatigue syndrome also is in there, headache and migraine, long COVID. So there are devices on the market for both headache and migraine and long COVID that have been approved by Health Canada. Rheumatoid arthritis, chronic pain conditions, inflammatory gut conditions, PTSD, which is going to be similar to the treatment-resistant depression in terms of how the vagus nerve helps with that, type 2 diabetes. There's also good evidence to show that age-related cognitive decline, dementia, and Alzheimer's can be helped with vagus nerve stimulation. Honestly, any of the structures that we talked about earlier that the vagus nerve interacts with, if you, especially if you go over to Google Scholar, where you can find a lot of research articles, if you pop in, gallbladder dysfunction and vagus nerve stimulation, you'll probably find an article that talks about a study that somebody is doing about that particular problem, condition, and ways that vagus nerve stimulation may or may not be helpful. It's not always the answer, obviously, but there are some really good results coming out of these. So the vagus nerve stimulation, actually, let's back up here for a second. When we talk about most of this research, most of the research is done on electrical stimulation to the vagus nerve. So for depression and epilepsy, most of the time what they're studying and how these are managed is with an implanted device that's similar to a pacemaker that stimulates the vagus nerve specifically all the time. And that obviously is pretty invasive, but there are other ways to deliver electricity to the nervous system. And one of those is a TENS machine or a Dr. Ho machine, the kind of things that a lot of people maybe already have to manage pain. So electrical stimulation delivered through the skin to the nervous system in specific areas of the body is usually what they study in terms of whether this is effective or not. However, there are a lot of other ways to stimulate the vagus nerve. Anytime we interact with a structure in the body, we cause the brain to pay more attention to that structure. So anytime we do work with structures that the vagus nerve regulates or brings information in from, we will ask our brain to pay more attention to the nerve. And when our brain is paying more attention to something, it increases the function of that structure and it increases the health of that. So just like if you were working out and you were going to do a ton of bicep curls, say, your brain would be paying a lot of attention to your biceps and the muscles that support the stability of the shoulder and the rest of the activity that you're doing, hanging on to that weight. Your brain's going to be paying attention to your wrist muscles that control the wrist flexion. And especially as you continue to go through your set of bicep curls and you start to get a little bit more fatigued, you're really going to be actually actively thinking about the muscles that are involved. Can I do one more rep? I don't know. I'm starting to feel pretty tired. Should I push this a little bit more? Maybe I need to drop my weights down. We're really focused very directly on that structure that we're using over and over again. So that's the concept that we're using here is anytime we focus our attention on a structure, the nervous system needs to pay more attention to that structure. So ways to stimulate the vagus nerve. I'm going to do a little bit of demonstration here as well. This is where we'll get into our self-care. But I'm going to start with the ones that I don't have to demonstrate here. So cold water immersion is very helpful for the vagus nerve. It's very stimulating. This is why people are into jumping into mountain lakes or cold baths or cold showers. Fortunately, you don't have to totally immerse yourself in cold water to stimulate your vagus nerve. Even just cold water to the face, especially while you're holding your breath, is stimulating. And this is because we have this mammalian dive reflex. So when we are immersed in cold water, our body wants to protect our vital organs. And so the vagus nerve activates to slow the breathing and to slow the heart rate in order to protect our metabolism and our brain. This is why jumping into a cold lake from a hot environment can be dangerous, because we can actually drop our heart rate low enough that we can pass out. This is why whitewater paddlers will splash their face with cold water before they jump into a technical section of the river, so that the first time they get splashed in the face with water, they don't pass out. That would be dangerous. But we can use this in healthy ways to stimulate our vagus nerve. So cold, a cold washcloth that you keep in your fridge or freezer that you apply to the face, especially the skin around the eyes. Doing that while you hold your breath activates that mammalian dive reflex. So you don't have to have a cold shower or a cold bath in order to get that benefit of cold water for your vagus nerve. Connecting with your loved ones is very stimulating to the vagus nerve. Co-regulation is another term we talk about a lot in nervous system work. And this is basically the ability to sense someone else's nervous system and respond to that. Probably the strongest example of this is a parent or a caregiver soothing an infant. So if the infant starts to cry, Their nervous system is elevated. The initial response from the caregiver is, oh no, the baby's crying. I got to go get the baby. So we get a little bit of mirroring of the infant stress response from the adult or the caregiver. Then the caregiver, hopefully, picks up the infant, holds it close, rocks it, maybe makes some shushing kind of white noise sort of sounds. And the caregiver's nervous system downregulates or gets into the relaxation response, and the infant's nervous system mirrors the caregiver's nervous system. So it happens very directly with parents and children, but it happens with friends, with partners, with your psychologist, with your massage therapist. If you have a massage therapist who has a calm nervous system, it can happen in groups of people. I know when I'm spending time with my safe people, my heart rate is significantly lower than when I'm spending time with people I find a little bit stressful or I'm just not as comfortable with. Mild exercise. So anything that you can combine exercise with breathing is going to be stimulating for your vagus nerve. Yoga, Pilates, going for a walk, slow running, anything that you can stay in your relaxed zone while you're exercising will be stimulating. Singing, gargling, and humming, because your vagus nerve activates your vocal cords. So that is very helpful as well. And then transcutaneous stimulation. So that's the electrical stimulation that goes through the skin. Whether you're using a marketed device for one of those, there's quite a lot of them on the market now. They're relatively expensive. They're in the kind of $300 to $500 range. Or whether you're using a TENS machine and you've found some protocols that are starting to become a little bit more available online to use a regular TENS machine to stimulate your vagus nerve, that's possible. I'm not going to go into that in this presentation because it's not something that I'm trained in as a massage therapist. But I did want to make you aware of that. I know some of the long COVID clinics are talking about this as well, transcutaneous stimulation in order to manage symptoms. Massage and self-massage. So I'll teach you a little bit of self-massage here in a moment, but massage is stimulating to your vagus nerve. It brings you into your parasympathetic zone as long as that massage feels good and safe to you. If you are going for a very painful massage, you might not be getting as much benefit for your vagus nerve and your relaxed nervous system as you do when you have a more relaxing massage. That doesn't mean that you can only do relaxation massage in order to stimulate your vagus nerve, but the massage can't feel like a threat to you if you're clenching your jaw and curling up your toes and hoping your therapist is going to stop doing what they're doing. You're probably entering your stress response. The basic exercise I'll show you in a minute here. It's an eye movement exercise that's very effective for activating your vagus nerve, and breathing. So one of the things I love about how the body and brain communicate is if we remember that the vagus nerve is 80 to 90% incoming information. That means that most of our safety cues come from our bodies to our brains. We usually think about it as my brain knows that I'm stressed and therefore makes my body act stressed. And that is true, but also our body informs our nervous system that we feel safe or unsafe. So an example of this is breathing. When we are stressed, we tend to breathe quickly. So we're taking short, shallow breaths. We're using mostly the upper third of our lungs. So we're upper lung breathing. We might be using the muscles in our neck and shoulder to breathe instead of allowing our diaphragm to do its full work. When we breathe with our full lung capacity and we allow our diaphragm to have its full expansion and contraction, we actually send a signal to our brains that we're safe. It's basically, I must be safe because I can't breathe like this when I'm not safe. So changing our breathing changes the safety cue from the environment. Just a note on diaphragm and what we call diaphragm breathing. So when we're breathing, we're always using our diaphragm. We can't breathe without it. However, a lot of people don't breathe sort of properly. And I don't want to get too technical about breathing. But a lot of people are chronic upper lung breathers. They tend to use the muscles in the neck and shoulder and the muscles in between the ribs more than they actually use their diaphragm. So the diaphragm is working, but it's not doing its full job. It's not getting its full excursion. Right now, because I'm talking, I'm not breathing properly. I'm not fully using my diaphragm to take big, full breaths. The physiological sigh is a way that we can activate our vagus nerve. It is a vagus nerve controlled response in the body. The physiological sigh is a double intake of breath and a long exhale. You will recognize this from especially children seem to do this, maybe just because we see children cry more than we see adults cry. But if someone is crying and they're trying to compose themselves, they do this sort of breathing, and that is the physiological sigh. It's the nervous system activating via the vagus nerve, activating that parasympathetic response to try and help you to calm down and feel better. So again, it's automatic. We do it while we're going to sleep. I notice that I do it during the day. If I'm sitting on the couch, reading a book, I'm relaxed, I might have this big extra intake of breath, and it does feel very relaxing. So it happens automatically. It is one of the responses we look for when we do vagus nerve work, but it is also something that we can use in order to activate our vagus nerve and our parasympathetic or our relaxation response. So to do this, you take an intake of breath, and I do think it's better to breathe in through your nose. There's a lot of evidence to show that that's really helpful for your body. So we would do our inhale through our nose. You can breathe out through your mouth or breathe out through your nose, whatever feels better to you. But this physiological sigh, when we're doing it on purpose, would look like this. So we're taking a relatively full inhale and then an extra inhale after that, and then a long and in some cases forceful exhale. You want your exhale to be longer than your inhales. That changes our blood chemistry and actually reduces the oxygen to the brain, which I know sounds like a bad thing, but it's not, in order to get relaxed. And that extra inhale of breath, so you do your first inhale, that second inhale helps to open the alveoli in the lung. Those are the tiny little sacs where most of your air exchange happens. So if our alveoli are nice and full of oxygen, when we're breathing in, we get better gas exchange in the lungs, and that's what changes that blood chemistry for us to, first of all, get more oxygen into the body, get more carbon dioxide out of the body, but that's what changes the response of the nervous system. So big breath, little extra inhale, and then a nice long exhale. There's been some good studies on the physiological sigh. Those of you who listen to the Huberman Lab podcast will recognize this. They talk a lot about the physiological sigh, and there's really good evidence to show that it performs as well as or better than 5 minutes of meditation, and that's 3 to 5 physiological sighs in a row. The basic exercise, this is another one that's quite easy to do, and the key to this is we're going to hold our head still and move our eyes only. So what we're trying to do here when we do the basic exercise is mess with the autopilot function of the brain a little bit. We really want to turn our head to the side, to look to the side. That's almost like a reflex in the body. And when we don't allow ourselves to do that, we fire up this sort of internal self-examination of, why am I not turning my head to look to the side? And that gets our vagus nerve activated, also gets our brain to pay attention to that spinal accessory nerve that uses those major neck movers, the traps and the SCM. So you don't have to hold your head still to do this, but I like to hold my head, especially at the beginning. Once you've been doing this for a while, you'll notice you can do it almost anywhere and you don't have to hold your head still. But what I like to do is take my fingers and place them at the base of my skull. And then I use my hands on the side of my jaw so I can feel if I'm trying to turn my head to the side. And all I'm going to do here, I've got a little bit of gentle pressure on the muscles at the base of my skull because it feels good, but also it's very connected to the vagus nerve there. And I'm going to start by looking to the right. So I'm going to take my eyes as far to the right as I comfortably can. I'm not straining my eyes. This doesn't hurt. Some of you might find that this makes you dizzy or nauseous. And of course, if it does, you can stop. Others of you might find this soothing right away. And for other people, this might just feel really annoying. It's worth sticking with it. But I do understand sometimes it's just really hard to do. And if you're watching my eyes, you're probably noticing that I'm having a hard time keeping them over to the right because I am talking to you and I really want to glance back at the screen. But what I do is I hold my gaze over there to the right until I have the impulse to yawn or swallow or sigh. And when you start doing this exercise, it might take you a minute each side. I'm going to come back to the center with my eyes. And then I'm going to take my eyes to the left. And I do the same thing over here. And again, I wait for my yawn, swallow, or sigh. When I first started doing this work, it would take me about a minute each side to get a response out of my vagus nerve, which are those 3 responses that we're looking for. Now, honestly, I get a response in 2 or 3 seconds. And the only reason I'm not yawning right now is because I'm actively preventing that so that I can continue talking. So that's the basic exercise. Hold your head still, bring your eyes to the side comfortably, hold them there until you get that response. For some people, you're not going to get responses right away. It might take 2 weeks of doing this regularly before you start getting responses. So you've got a couple of options. You can hold your gaze to the side for a minute each side and continue doing that daily until you start getting responses, or you can commit to waiting for that response. It probably won't take more than a couple of minutes if you are willing to commit to that. But I'll leave that up to you. Whatever feels better to you is fine. I do highly recommend doing this regularly, a couple of times a day. So that's the basic exercise. And again, once you get fast at it, when I first started doing this, I was doing it in bed in the evening. It's a great time to do this. It does wind your brain down for sleep as well. And I found it pretty easy. When I went through a stressful period of time, I was trying to make a decision. I was having a hard time making that decision, and I was pretty agitated about it. I was pacing around my house. I felt like I couldn't settle down and use my executive function. I couldn't just think through the decision. I thought, okay, I should probably try some vagus work. So I lay down on the couch and started doing this basic exercise and another sort of massage exercise that I use. It took me 15 minutes before I could get a response. But when I did get a response, I felt way more settled, way more grounded. I was able to sit and think through the possible outcomes of the decision and then make a decision and live with the consequences of it. So it is much more difficult when we're in a state of anxiety. It does work. Now that I've been doing it for a long time, I've been doing this since last April, I think, very regularly. I use it all the time for calming down my nervous system if I'm in a painful or scary situation. Like I had to get a little weird thing cut off of my eyelid. So I had to get a needle in the side of my eyelid, which I was not excited about. But I laid on the table and did my vagus work. I'm yawning while she's sticking a needle in my eyelid. But it helps me to remind myself that that needle in my eyelid is not actually a threat to my life. It doesn't feel great, but I'm safe. So I use the basic exercise really regularly. So let's talk a little bit about massage and self-massage. This is something that obviously I do a lot of in my practice, but I also do it a lot for myself. So I start with my trigeminal nerve pathway because the trigeminal nerve is so connected to the vagus nerve. I like to get the trigeminal nerve inflammation down before I start my vagus nerve work. So the trigeminal nerve pathway is as follows. So right underneath the eyebrow, you've got this little notch in the orbital bone here, your supraorbital notch. This might be achy if you press hard in here. We are not pressing hard. Okay, this is very, very light. I do a little bit of gentle pressure in here, maybe some little circles or whatever. And then I follow the orbital bone or the top of the eye socket there out towards my temples. I do each of my pathways 3 times because 3 is predictable and it feels good to our nervous system. So that's the first one. The next pathway is right where the cheekbone meets the nose. And any of these pathways might feel a little bit achy to you when you first get started. If they are feeling achy, you know you're in the right spot, but go gentle on them. This is not like muscle work where we can kind of like dig in and get a response from the muscles. There's no pressure sensor in the nerve that is going to reduce its inflammation in response to pressure. In fact, if we crush that nerve, we're just going to increase the inflammation there. The next point is just beside the nostrils. I'm almost pushing up on the base of my cheekbone here. This one, when I'm a little inflamed, I know it right away because this one's quite achy. And then I follow out the bottom of the cheekbone towards the ear. So again, I do each of these 3 times because it feels good. And then the last one is kind of just below the corner of the lip on top of the chin. And to find this one, I usually just stack my fingers in the center of my chin and then roll outward. And this one is actually inflamed. As soon as I hit this one, it gives me a tiny little headache right here. So a little bit of gentle pressure here. I'm not at the point where it's causing me any pain. And then I follow out the jaw towards the earlobe. So again, a little bit of gentle pressure there. Imagine these nerves are like a piece of tooth floss laying underneath your skin and you're just stroking it very gently. We don't want to cause any extra inflammation. So that's our trigeminal pathway. I usually start with that. And then we have some vagus nerve points that can be really helpful. So I'll show you some of my favorites. There's way more, but I'm just going to focus on a couple because you don't need a whole bunch of information at once here. Right at the base of the ear and the jaw. So this little spot right here, the vagus nerve is very superficial. I'm really close to the top of sternocleidomastoid, which is this muscle that comes across the neck from the base of the skull to the collarbone in the sternum. And so I'm just basically taking the skin and moving it in circles. You can go, it doesn't have to be a circle. Just massage this in whatever way feels nice to you. But again, this is very, very light. It's almost just the pressure of my fingers on my skin. I'm not trying to dig in here. The skin behind the ear is very stimulating to the vagus nerve. So I like this a lot. And I'll often do the skin behind the ear and then down the side of the neck to this spot just above my collarbone. So if you can find SCM as you turn your head, it's this one that often kind of pops out. If you follow that to its base and then you come just to the outside of that, I kind of pop my collarbone forward and I'm doing very gentle circles in here. There's quite a lot of nervous system structures in here. And so we don't want to dig in. We're just being nice to it. So I'll often go from the skin behind my ear, down the side of my neck to this spot just above my collarbone. Those are my favorite spots. The other one is at the base of the skull. So I'll see if I can show you this one. What we want to do here is just a little bit of a skin stretch. And again, really easy, really light, no pressure. So I'm taking 2 fingers, I'm placing them on the skin at the base of the skull. I'm not on the bone of the skull itself, I'm just below. And I'm going to take my top finger and pull it outwards towards my ear. And I'm going to take my bottom finger and push it inwards towards my spine. The amount of pressure you can do with 2 fingers, and all I'm doing is just stretching the skin and holding that stimulation. What we're looking for here is a little bit of stimulation to the nerves that are right below the skin there. We're moving connective tissue around and we're getting a response out of the nervous system right there. So that's another one that I use pretty regularly. And that one too, I usually just get my fingers back there and make that little pull one way, push the other way, and wait until I get my yawn, swallow, or sigh. So those are my favorite vagus nerve spots. When I do vagus nerve work in the clinic, I spend a lot of time doing very soothing massage to the face, the scalp, the outside muscles of the jaw, the neck, the base of the skull, and the upper shoulder. This often happens at the end of a treatment after we've worked through releasing a lot of the trigger points and the pressure, the tension that's in those muscles. But on that note, even doing the basic exercise can help to reduce the tension that we carry through our neck and shoulders. So that's one of the techniques that you can do if you are someone who suffers from chronic neck and shoulder tension, chronic headache. Try doing a rotation of your head, like how far can I look this way? How far can I look this way? And then do that basic exercise. Hold your head still, cast the eyes to the side, hold them until you get your yawn, swallow, or sigh, or hold them for a minute. Do both sides. And then try again and see if you can go a little bit farther. Some people respond great to this. Other people don't respond that great to it. Everybody's different, but that basic exercise is really foundational. While we're on the note of vagus nerve stimulation here, I highly recommend doing this regularly, at least once a day. Twice a day or more is better because our nervous system loves consistency. The more we do something, the easier it becomes, the better that pathway becomes. So invest in it, commit to doing it regularly, whichever one of these you like. Honestly, for me, it's breath work, the basic exercise, and self-massage. But all of these other techniques are really helpful as well. In the studies I've read on vagus nerve work, some people find some benefit right away. They notice a reduction in symptoms. Other people don't notice that benefit for 10 weeks or 12 weeks. That's usually kind of, there's 2 groups that show up in these studies. And if we think about a dysregulated nervous system, I saw this great post online where this woman had a video representing a dysregulated nervous system with a big bowl of Cheerios. And so she said, imagine all these Cheerios, this is the dysregulation in your nervous system. And if you decide you're going to commit to doing some breathing work, a basic exercise, and self-massage or cold water immersion or whatever it is, you're going to do that every day. Great. Day 1, You do each of those things, you take 3 Cheerios out of that bowl. Doesn't feel any different. Day 2, same thing. You take 3 Cheerios out, still doesn't feel any different. Maybe 2 weeks later, 3 weeks later, a month later, you're starting to reduce the amount of cereal that's in that bowl. You start to notice a difference. You start to feel better. But it takes the regularity of doing the work. And that's actually what makes this so difficult. Somebody I was listening to was talking about concussion recovery and how important nervous system regulation is for concussion recovery. His comment on it was, these exercises are simple, but they're not easy. And the reason they're not easy is because they're self-care. And every time we get started on self-care, no matter how easy it feels, it's or how simple it is, it never feels easy. It's easier to ignore or to not do it. I get to the end of the day, I'm tired, I'm going to bed. I don't want to massage my face. I just want to go to bed. But one of the reasons why I do a lot of my vagus nerve work in bed is because I'm there anyway, and I'm not going to fall asleep in 3 minutes. So I might as well take those 3 minutes to do a little bit of vagus work, get my body into its relaxed nervous system, get my brain relaxed. I sleep better when I've done some vagus work right before I go to bed as well. Okay, when we talk about outcomes, like I said at the beginning, the conditions are complex. They have symptoms that overlap, that vary based on a lot of factors like your stress, your social support, your beliefs about healing and about your body. So it is complicated. This is not easy stuff. But conditions where I've seen changes for clients include chronic headache and migraine. In some cases, when we couldn't make a difference with massage, it was the nervous system work that made a difference. IBS symptoms, facial pain and swelling, tinnitus, vertigo, long COVID, depression, anxiety, and ADHD. I have ADHD. I use this work really regularly, and it allows me to take less medication. I'm not at all against medication. I love my ADHD meds. They work really, really well for me. However, I like taking less medication if I can. And so when I'm doing good vagus work, I actually can take less medication and still feel really good. Like I said a couple of times here, consistency is key, which is what makes this hard. So finding ways to remind yourself, finding ways to build in habits, reminders, ways to make sure that you can get to this work, to do it, a couple minutes in the morning and a couple minutes at night really does make a difference. It might be slow to see change. For some people, they notice it right away. I have a client who deals with anxiety, and he kind of grabbed onto this work right away. And I think the next time I saw him was 2 weeks later, and he said, my anxiety feels so much better. I think what he said was something like, it's like my brain isn't scared of being scared anymore because I know I have a tool. And that's been noticed by a lot of other people in this person's life as well. So for some people, it works right away and they notice a difference. And so then, of course, we're going to keep doing it because we know that it helps. For other people, it does take longer. And some people decide, maybe it's not for me, or I don't really feel like working on it. And that's okay too. One of the things I always tell my clients is massage is a great input into the nervous system. I see it as like this massive dump of information into your nervous system to help the nervous system learn what regulation feels like, what relaxed feels like. For some of my clients, they'll tell me being on the massage table is the most relaxed I am all week long. And I love that. That's really gratifying. But also it's the work that you do every day that really makes the difference. So massage can kind of, if we were looking at like a graph of how the nervous system responds to change. And in this case, we want, we want our nervous system to be down regulated. So I'm going to use a downward line here. Massage might give you like a sharp drop in that regulation of the nervous system, drop being good. I feel like I'm doing this backwards, but in any case, a nice down regulation of the nervous system. And then when you leave the massage, other stressors show up. Maybe you start to climb up a little bit. The regular work you do at home is going to keep that either plateauing or starting to slowly decrease. Getting another massage can be another nice down regulation bump to your nervous system. Opposite of bump, drop to your nervous system. It really is the work that you do at home. So one of the things that I like to emphasize is you can always come for massage if you're a client of mine or you want to try this out. And if you haven't done any of the homework, the next time you see me, that's okay. We're still going to work with the nervous system. We're still going to find that benefit from the massage itself. You definitely get better faster. You notice more change if you do work regularly. And honestly, it's the same for other types of massage. If you come see me for muscular pain, I'm going to tell you the same thing. What I do in an hour is a little tiny bit compared to what you do in all of the other hours of the week that you're not on my massage table. So one of the things I love about this work is it's free, it's simple, it's easy, it's empowering because you don't need somebody else to do it for you. You can do it for yourself. But it is nice to have some training in it so you can feel what it feels like on your body. And you've got that sort of extra solid input into your nervous system. So that's where I see massage fitting into this work. But you absolutely don't need to be seeing a massage therapist to learn to regulate your nervous system like this. There's a lot of power that's in your hands. So that brings us to the end of the presentation. There's contact information for me here. Again, I'm very happy to answer questions. I love talking about the vagus nerve, so much so that for a while, my son told me I wasn't allowed to use the word vagus in the house, and I had to start calling it the bagel nerve because that, for some reason, was better. But yeah, I love this stuff. I love talking about it. I think it brings a lot of hope to people who maybe haven't seen success in a lot of other ways. So please feel free to drop me an email, or you can find me on Facebook or on Instagram. If you're in Cochrane, you can absolutely come and see me. But again, you don't have to be a client of mine to have a conversation with me about how this might help you and how it might work. So thank you for your attention. Thank you for being here. I hope that it was effective. And I'd love to hear how it goes for you. If you want to let me know.